What are the common medical myths? What are the facts behind them? Let's learn now.
Hello everyone, we are the Special Project Committee from the Asian Pharmacists Association. We will be presenting a topic on myth and facts about medicine. We are all pharmacy students at the University of Illinois at Chicago College of Pharmacy. Now, I am going to present the speakers for today. My name is Anne.
My name is Eileen.
My name is Jared.
My name is Anna.
My name is Cherry.
My name is Chloe.
My name is Justin.
My name is Melody.
This is our objective for today. Without further ado, let's get started. The first myth is depression is curable. So what is depression? Depression is a common and a serious mood disorder where one feels persistent sadness, depressed mood, loss of interest, unmotivated to the point that it may interfere with one's ability to function on a daily basis. Depression is very common, and statistically in the US alone, depression affects 1 in 15 adults. It can occur to any of us, which could be caused from a variety of factors, but not limited to biological differences, brain chemistry, hormones, and genetics. People with depressions appear to have an imbalance of chemicals or physical changes in the brain. Depression could be a result of hormone imbalances, which can occur in pregnancy or thyroid conditions. Depression can be diagnosed by a licensed psychiatrist, and it is treatable but not curable. This is because curing a disease implies that after appropriate and adequate treatments, the patient will no longer have that disease anymore. Whereas treating a disease refers to an ongoing process of alleviating symptoms of a disease through appropriate and effective treatments. For instance, tinea pedis, which is commonly known as athlete's foot, is curable as it goes away with adequate treatment. Some of the treatment options for depression include anti-anxiety along with therapy. Treatment options are tailored to patients' need. Antidepressants are not a cure-all treatment. However, it is statistically proven to be 60 to 80% effective in patients. There are many other diseases that are treatable yet not curable, such as diabetes and dementia.
Myth number 2. Acupuncture is ancient folk medicine and it is not a legitimate treatment. Acupuncture has been around for a long time. It is recognized by the NIH, the WHO, and the National Cancer Institute as a clinically proven treatment. There are currently various certifications and insurances that covers acupuncture in more than 40 states. So how does it work? In Chinese traditional medicine, it is believed that if a point in the body is blocked, then the constant flow of qi, which is essential for one's health, will stop moving. By puncturing it, a person's balance is restored. However, the more modern scientific explanation for acupuncture is that needling an acupuncture point will stimulate the body to release chemicals in the muscle, spinal cord, and brain. Thus, this clinically proven treatment is typically recommended for patients to relieve pain, arthritis, and adverse reactions to chemotherapy.
Myth number 3, winter weather causes colds. According to the Centers for Disease Control and Prevention, millions of people develop the common cold each year in the US alone. More than 200 viruses can cause the common cold. Rhinoviruses are the most common cause. These viruses spread through direct person-to-person contact, the air as small droplets or aerosols, which people then inhale. Once inhaled, the rhinovirus attaches itself to the cells inside the nasal passages. It then begins to replicate itself, spreading more virus particles throughout the upper respiratory tract. People mistakenly winter weather causes colds because cold weather can adversely affect a person's immune response, making it harder for the body to fight off infections. The cold weather decreases the temperature of the nasal cavity, causes a reduction in the effectiveness of local defenses within the nose. As a result, airborne viruses like the human rhinoviruses can easily pass through the host defenses and infect an individual. So the cold weather can make you more susceptible to the common cold, but not directly cause the cold itself. Viruses may survive and reproduce more effectively at colder temperatures, making it easier for them to spread and infect more people as well. Also, during winter, we spend more time in close place, close to each other, so that we have more prolonged face-to-face contact to spread the virus. Takeaway here, viruses such as rhinoviruses can cause colds, not the weather. However, exposure to cold weather can increase a person's risk of contracting a virus.
Myth number 4 is that the flu vaccine can cause the flu and other diseases. Many communities, including the Asian community, may have different preconceptions about vaccinations based on their ethnicity or religion. This is why education is important to debunk false myths about vaccines. The influenza vaccine does not cause flu, autism, or other diseases based on available evidence. Even though the vaccine is not 100% effective, if the patient gets influenza after getting the vaccine can effectively reduce serious complications of the infection. It also takes 2 weeks to work, so the patient could have gotten influenza within that time frame. According to multiple studies, people can actually withstand many vaccines administered at the same time. The flu shot prevents influenza, pneumonia, 50% of hospitalizations, and 80% of deaths. Only 3 to 5% of people who receive the shot report injection site tenderness or low-grade fevers. So the takeaway is that the annual flu shot's benefits far exceeds its risks, and this can be applied to many other vaccines, including the COVID vaccine.
Myth number 5 is that brand name medications are better than generic. Some people believe that generic medications are inferior to brand name medications. However, generic medications are created to be the same as an existing approved brand name medication in dosage form, safety, strength, route of administration, quality, and performance characteristics. Generics use the same active ingredients as brand names and work the same way, so they have the same risks and benefits. The FDA requires drug companies to demonstrate that the generic can be effectively substituted and provide the same clinical benefits as the brand name it copies. Generic medications tend to cost less than their brand name counterparts. Generic manufacturers are able to sell their products for lower prices, not because the products are of lesser quality, but because generic manufacturers generally do not engage in costly advertising, marketing and promotion, or significant research and development. When multiple generic companies market a single approved product, market competition typically results in prices above about 85% less than the brand name. Before releasing a generic equivalent to the market, the FDA monitors for harmful drug reactions, and it has found the same levels of side effects in generic and brand name medications. Generic medications don't have any side effects that are not also found in brand name medications. With generics, you'll receive the same health benefits you receive from the brand name.
Myth number 6 is that you can use antibiotics for all illnesses, which is definitely not true. There's a great misunderstanding that since antibiotics can cure an illness, that it can also be utilized for all symptoms, especially those that are related to cold symptoms. Antibiotics are a type of medication used to fight illnesses, yes, but for those specifically caused by bacteria. These drugs typically target cell walls, cell membranes, and bacterial enzymes used by these bacteria to reproduce. For that reason, we do not see effectiveness with diseases caused by viruses. Viruses have different protective structures as well as a different mechanism of reproducing that antibiotics do not effectively target. However, misinformation leads to individuals not taking these antibiotics appropriately and leading to strains or populations of bacteria that are resistant to these medication. This causes much stress to the medical community as they scramble to find new medications that are effective in fighting off the bacteria. To add some statistics, according to the CDC Antimicrobial Resistance 2019 report, approximately 2.8 million antibiotic-resistant infections occur in the US each year, and more than 35,000 individuals die. To be sure that we do not worsen this situation, it is crucial for patients like us to use the antibiotics as prescribed by our doctors so we do not reach a point where bacteria are resistant to all of our known antibiotic medication.
Myth number 7 is that all hand sanitizers are equal. Now that the pandemic is going on, hand sanitizers are becoming a hot commodity. People believe that all sanitizers are the same, but it is true that different hand sanitizers have various usages and effectiveness, so they're not all created equal. There are 2 types of hand sanitizers. There are alcohol-based and there are alcohol-free hand sanitizers. Alcohol-based contain ethanol, isopropanol, and propanol. Alcohol-free contain various disinfectants or antimicrobial agents. The WHO and CDC promote alcohol-based as being more effective against bacteria and viruses and more safe for you and your environment. Hand sanitizers that contain alcohol vary in strength. It is recommended by the CDC that use hand sanitizer that is 60% alcohol for effectiveness. So when you are looking to buy hand sanitizers, make sure that it has 60% alcohol or more. There's also antibacterial and antimicrobial. Antibacterials only destroy bacteria, so this will not help against COVID because it is a virus, not a bacteria. Antimicrobials destroy bacteria, fungi, parasites, and certain viruses. So this is a better option to take during the pandemic since it can help stop the spread of COVID.
Myth 8. Inhaled steroid will dramatically affect a child's head. The truth is, the effect of inhaled steroid on child's head is very small. The inhaled corticosteroid, those are the drugs that a doctor prescribes to help control inflammation. They are used to help control conditions like asthma. For children, there may be a slight slowing in growth from inhaled steroid, but the difference in height is very small, and the side effect is rare. For most people, this is made up for the improved ability to breathe because of the positive effects of the medication. In fact, if leave asthma untreated, it may actually delay the onset of the puberty. That's not to say that inhaled corticosteroids do not have any side effects. Some common side effects of corticosteroids including sore throat, hoarseness, and nosebleeds. More severe side effects may occur with high-dose inhaled corticosteroids or incorrect use of the inhaler. If you are concerned about using inhaled corticosteroids, you could reach out to a healthcare provider who could give you a determination by perform a risk-benefit assessment. That's all for our Myth and Facts presentation. Thank you very much for watching.
Hello everyone! We would like to thank you for your time watching this video. My name is Chia Lee and I'm currently a P3 and the Vice President of Asian Pharmacists Association. I'm the person in charge of overseeing the Special Projects Committee and the video editing. Please feel free to contact us if you have any suggestions or improvements. Once again, please subscribe our channel and stay tuned for more videos.